but we'll explain that a little bit later in detail. I have the Council Chair Alice Lee here, and some of the council members. Today I requested $4 million budget amendment so that the county can not only plan, mitigate, respond, and recover from any coronavirus incident or incidents, yeah? I'm also creating a task force to address this issue. Now, this task force will be made of private sector, government agencies, as well as nonprofits who are impacted greatly by this event. So I want everyone to understand that we are going to work very diligently to prevent possible and mitigate or minimize any impact of the COVID-19. I'm also recommending cancellation of large public gatherings that would prevent any social distancing measures. Social distancing is really measures that we would ask people not to gather in big groups, not to have big events, to cancel whatever events they have scheduled, and whenever you're out and about, to keep some distance between you and the next person. They suggest 16 feet. According to Dr. Pang, when we speak or we sneeze or we cough, we may project 4 feet of airborne pathogens. Maybe 6 feet, right, Dr. Weiss? You know, 8, 6, 8, 10.
Zone of safety.
A zone of 6 feet. If anyone wants to know what's a zone of 6 feet, I can show you right here. This is a zone of 6 feet. So I hate to say it, Chair, you're in my zone. But no, that's 6 feet. You know, basically that would be about 6 feet. And so we want to make sure that we protect all those involved. This Saturday is actually MEO's big gala event, and we're asking to postpone it. And okay? And I know my wife has called me a couple of times because this event was our family event and they were going to honor me. I'm not worried about the honoring part. I'm worried about the citizenry and that no one is affected adversely, yeah? MEDB has also announced the postponement of the energy conference that was supposed to start next week, Tuesday. So all of these things are coming up very quickly and we're taking immediate action. Recommending social distancing is a measure which the community can take on, the county can also embrace, and all of you as citizens can embrace. We will continue service that will interact with the public and try to keep public events at a minimum, if at best. We will look to do teleconferencing. We will look at some of these issues that we can change what is going on around you. We will continue to develop continuity in operations for each of our departments. Right now, most of them are working on plans that have been in place, but now they're reviewing to make sure that they're current and that we are ready in case of any type of shutdown or any type of outbreak that may occur in Maui. We have the fire, police, also water, refuse, sewer, roads, and public transportation, which is essential to every citizen in this community. And so we are making sure that these particular departments, along with all of our departments, are ready and able to meet any threat that may occur. I've already directed all county departments to increase sanitizing efforts 3 times over. That's Dr. Pang's theory that if you wash your hands, wash them 3 times more than you normally did. If you do something that is not good, like coughing, cough 1/3 of the time. I don't know how you do that part, but you know that was his idea, that take things down and break them down to doing more what is good and try to do less that is not good for us. We are now making sure that our buses, and thank you to Mark Takamori and his staff, are now being cleaned 3 times a day, completely sanitized inside. Okay, wiping all the rails, wiping all the handbars, anything, seats, the whole 9 yards. All of our county facilities, including parks, have upped their game as far as cleanliness is concerned. They are now cleaning all of the restrooms 3 times a day when they might have been doing it once a day. All of our public facilities, starting with this county building and going through every community center and every office facility is being cleaned 3 times a day, if not more. We're taking this very seriously to protect the citizens of Maui County, and I think this is very important. We're also looking at air conditioning filters and other air filtration systems, having filters replaced more often. We're looking at every method right now to prevent the spread of any virus, let alone the COVID-19. I'm recommending county employees do not come to work if they're sick. I would recommend that to even the private sector. I would recommend that to students, to their parents, that if the child is sick, please keep them home. The best way to prevent this from spreading is quarantine, especially self-quarantine. Very, very important. I've ordered all out-of-state travel suspended, effective immediately. Inter-island travel, some counties have basically suspended that also. We cannot. Many of our essential services, our employees must go to Lanai and Molokai. Sometimes they have to fly to Honolulu and then go to Molokai or Lanai. It's not always possible to catch the boats, or with Lanai, there is no ferry system anymore. So we understand that, and we are taking immediate action to make sure that they still bring the services needed to our neighbor islands. Yeah. Finally, our Maui Emergency Management Agency, led by Herman Andaya, has been actively coordinating and hosting video calls with the Governor's Office, Department of Health, and other neighbor islands. Conversations between our various state, federal, and county partners occur daily. So we keep up in what's going on between what we're doing here and what they're doing there. For myself and my administration, we have been meeting daily, and sometimes more than daily, with all of these issues being brought to the forefront each and every day. Let me say it in this manner. We've had to pivot and turn on a dime many times. We've had to change the game plan many times because things change. I'm very confident after my visit to the Maui Memorial Hospital facility, and as well as some of the other clinics that we have here in Maui, that we are very well positioned and prepared for what I call a slow and easy growth if the virus was to spread. The thing I'm praying for, and we all need to watch real carefully, is a sudden outbreak. And I think Dr. Weiss will address that, and Dr. Peng will address that a little bit later. Finally, I have been meeting with all the groups throughout Maui County, nonprofits, the tourist industry, local businesses, other government agencies, and others that are impacted or could be impacted, construction and other industries, so that they are prepared and know what we're thinking, and I understand what they're thinking and what they need and how we can help them along. I will tell you that I'm excited in a sense that this gives us a great opportunity to show that Maui can come together as a community. I've always said, it's not about me, it's about we. And this community is always about we, the people. And it's always come together whenever necessary. Lieutenant Josh Green has taken the lead from the state in the effort by the state to go throughout those communities, all the rural communities, as well as the urban areas, to make sure our facilities, our medical facilities especially, are prepared. I support and have sent a letter to the Department of Transportation, Federal Department of Transportation, requesting that cruise liners take a moratorium of 60 days minimum while we get this challenge taken care of. My major concern again is our adults, our seniors especially, because they are the most vulnerable part of our community. Not to say that children and others are not, but the history has shown and the statistics has shown that the seniors are the most vulnerable community, especially 60 and older. And so we're asking also those particular groups not to get together in large groups, to try to be self-monitoring and to protect one another. I'll close with this. Please help your neighbor. Be a part of this community. And at this time, let me say, we have very little to fear except fear itself. And that's something that I'm proud to say. Maui County is ready, as any other county, and probably better than most, for any event that should occur. So at this time, I would like to ask Herman Andaya from MEMA to come and say a few words and give you some of the highlights and what he's been working on, followed by the police and fire. Then Council Chair, Dr. Wise, Dr. Pang, and then airports. I don't see.
It's over there.
Oh, he's sitting in a corner there. There's Mr. Marvin Muniz, our airport manager. Thank you, Marvin, for being here last minute. So let's start with Mima and Norman. Herman Andaya. I said Norman. Sorry, Herman.
Okay.
Go ahead.
Thank you
And
very
please
much.
speak up because they need the, yeah.
Yes, sir. Thank you very much, Mr. Mayor. I will reiterate that there are no confirmed cases of COVID-19 within the county of Maui. Nonetheless, the mayor has prudently elected to lean forward on this matter, and he has directed preparations in the event of a confirmed case. He has called for the activation of the Emergency Operations Center, the EOC, and we have been working closely with our State Department of Health. We continue to participate in daily statewide video teleconferences with the governor, the adjutant general, director of the Department of Health, county mayors, emergency management administrators, Department of Health director, and with the 2 confirmed cases in Oahu, there is an uptempo in the battle rhythm of our agency as we continue to follow the pandemic plan for the county of Maui. The Emergency Operations Center has been activated at a level 3 activation. County, state, federal partners are all participating in the Maui County EOC. It is a location for representatives to work through problems toward a common goal for the effective use of resources and personnel. The EOC is operating as designed and addressing the needs of the county at the guidance of the State of Hawaii Department of Health. This is a reminder to the community to please follow DOH guidance of washing your hands and staying home if you are sick. In addition, similar to other emergencies, prepare an emergency kit. If you're asked to quarantine at home by a medical professional, please do so and make a plan for your family and your business. And be informed using trusted sources.
Thank you, Herman. Now, police, please. Chief.
Thank you, Mr. Mayor. Good afternoon. The Maui Police Department is proactively taking measures to ensure the safety of all of our personnel, families, and the community. At this time, we are monitoring the disseminating of the information that has been put out by CDC and also the Maui Emergency Agency, ensuring that the necessary equipment, personnel, and are in place to address evolving situation, as you can see. We continue to work with the various agencies, and our community operations plan is continue as we know that from time to time, as the situation raises, we have to be prepared for that. We want to assure the public that the Maui Police Department is here to help you. We ask the community to do your part and complies with the recommendation of the CTC and the Department of Health. There are some concerns as a chief of police. As you know, the impact on first responders, potentially reducing the number of officers able to handle emergency service. To prevent that and keep our officers and our employees safe, we are working on a series of guidelines and procedures in place. We also asked the Corporation Council to provide us with guidance that we need just in case there is an order for quarantine. All patrol officers and officers likely to come in contact with someone, we provide them with the protective equipment, such as gloves, protection mask, and others. Right now, what we are doing is we are doing inventory with all our districts to see where they are with their current supplies. So at this time, we ask our community to do your part and help us to prevent the spread of COVID-19. Thank you.
Thank you, Chief. Now we could have the fire department, please.
Thank you. Aloha, I'm Assistant Chief Mike Werner, Maui Fire Department. The CDC and the Department of Health, the state of Hawaii, and our department medical director has provided guidance for first responders, so we're following that guidance. We've been doing what the mayor asked as far as limiting travel. Our major concern is that we are able to continue to provide services, so we're protecting our personnel. So our PPE has upgraded to N95 masks every time that we go onto a medical call, and we've changed our protocol to have only 2 personnel go in to deal with the patient to assess them, and we have 2 personnel standing outside to decon them should that be necessary. We've had to cancel our school visits and our station visits for now, and some of our outreach programs, like we've canceled the Kaunoa Senior Center's cooking demonstration. We've been attending all of the EOC activations and working on updating our continuity of our biggest worry is if this becomes something big is PPE. So we've been working with the EOC and with our partners to try to get more PPE. So should this become something like that?
Will you tell what PPE?
Oh, sorry, our personal protective equipment, our masks, our gowns, those types of things. So that's basically what we are currently doing right now. Thank you.
Thank you, Chief. Our chair now, Madam Chair.
Thank you. Good afternoon, everyone. I'm Alice Lee, your county chair, county council chair, and with me today are some members, Council Member Tasha Kama, Council Member Mike Molina, and Council Member Tamara Paulton. Are there any others in the audience? If not, we'd like to thank the mayor for putting this update meeting together. Your council is very concerned, of course, like everyone else, about this growing issue of the COVID-19. And as a result, due to the wide ranges of issues prompted by an ever-changing landscape because of the COVID-19 virus, almost hourly sometimes, I am recommending that tomorrow's council meeting be streamlined to address only time-sensitive matters such as budget issues or boards and commissions issues and health matters. The rest of the items will be postponed till a later date. I have also asked the chair of the budget committee, Keani Rollins Fernandez, to cancel all budget district meetings. Further, I am also working on telecommunications options for members, staff, and the public. We have sunshine law challenges as well as technical challenges at this time. So that pretty much covers your update for now, and we thank you. If you have any questions regarding the council and council meetings, please feel free to call us at 270-7838. Thank you very much.
Thank you, Chair. Now, Dr. Weiss, please.
Thank you, Mr. Mayor. Good afternoon, and thank you for inviting me to speak with you. My name is Dr. Lee Weiss. I am the chairman and medical director of the Department of Emergency Medicine at Maui Memorial Medical Center. It's a privilege to be with you today. We're facing an enormous challenge, but we're up for the challenge. Our challenge is to make sure that the emergency department and the hospital stays open and is ready to serve all of the citizens and visitors of our wonderful home. The challenge is to not contaminate safe areas, but still be able to deliver care. To date, what we've done is taken a proactive approach and moved our triage process outside of the building. Under a tent, you'll be greeted by a nurse in personal protective equipment who will quickly take your temperature and grab a early history of travel and symptomology. If you fit the case definition of either influenza or COVID-19, you will be segregated into a private room and masked and placed in a gown such that you're comforted, ready for evaluation, but out of the way of other patients that don't have those symptoms. Our goal is to provide care to everyone that presents in the fastest way possible, but also in the safest way possible. We've done a top-down review of all of our policies and procedures and equipment in the emergency department and the entire hospital, and are ready for a surge if that befalls us. We can expand critical care beds right now by 20%. We have enough ventilators for all of those critical care beds, remembering that COVID-19 is predominantly a respiratory disease, and in the extremes of age can lead to respiratory failure and the need to provide that kind of support. We are blessed on this island to have a spectacular group of medical experts and nurses who provide care in a seamless fashion. They are tireless workers who are up to this challenge. I want to assure the citizens of this community and the visitors of this community that we're serious about what we do. We have the expertise to meet this challenge and go beyond it and deliver world-class quality and personalized attention that I would describe as Maui strong. Earlier, our mayor properly described what Franklin Delano Roosevelt told us years and years ago. The only thing that we have to fear is fear itself. Calm attention to detail is what's necessary. Let's fall back to community where we care for one another, look in on one another, and support one another. Hand washing is a first line defense. Maintaining the zone of safety, 6 feet, at all times decreases the risk of acquiring the virus. To date, there is no medicine for this virus, and there is no vaccine for it. We know the federal government, the Centers for Disease Control, the National Institute of Allergy and Infectious Diseases are all working tirelessly to develop a vaccine and medication, and we believe that that will happen in due time. I'd like to close by telling you that I know for a fact that we can meet this challenge based upon the past history of meeting challenges and exceeding expectation that the citizens of Maui routinely exhibit. I stand ready, as do my colleagues, to deliver that care and meet that challenge. Thank you very much.
Thank you, Dr. Weiss. And now I'd like to call up Dr. Payne, our #1 lead man.
Thank you. I'm Dr. Pang. I've been your health officer for Maui County for 20 years. I'll just start off with something from Angela Merkel. She's the leader of the Germans. That didn't sound right. She's the leader of the country of Germany. Sorry. She says that she thinks 70% of Germany will be infected by the time this is over. So I'll just use that number, 70%. If 70% of Maui gets infected, I don't think, maybe we can handle it over 4 or 5 years, overloading the hospital, all the essential services, the schools. Maybe we can muddle through over 5 years, but we surely cannot muddle through 70% infected over 6 months. And so our job is to keep this thing at bay so it kind of seeps in rather than floods in. So what, Pang, you think you can do it? Italy doesn't seem to be able to. Seattle doesn't seem to be able to. Well, 3 years ago, there was another droplet spread disease here, mumps. It hit Hawaii. There were 1,000 cases over 1 year, 1,000 cases in the state. Maui has 15% of the population, so maybe we should have seen 150 cases because Big Island saw their cut, Kauai saw their cut, and Oahu saw their cut, but we had 7 cases. Whoa. Droplet spread disease, you're expecting 150, you saw 7. We had a lot of public education, we had a lot of contact tracing, and somehow the Maui guys kind of came through. Already I can see the Maui guys kind of coming through. 2 weeks ago, we had a meeting like this, and you know, when the mayor has his meeting, I just kind of look around at the people and I watch the people touch their face. Congratulations. We've had a 10-minute period where three people touch their face. That was unheard of during the mayor's first meeting. At any time, 15 people, 15% were touching their face. So you kind of get the message. So we went over the things to stop this, you know, hand washing, cough into your sleeves, social distancing, and that includes social distancing means don't go out if you're sick, don't see grandma if you don't have to. And then I want to talk one more thing, disinfecting the surfaces. Thank goodness we live in Hawaii. You can wipe this down, yes, with the Clorox or whatever, but our ambient temperature, especially in the spring and summer, will kill the virus pretty quickly. So it's kind of like naturally disinfecting. So we asked the mayor, can you just turn down the air conditioning for the buses, for the buildings, open it up, and that's good. I do not like abstinence. I do not say turn off the air conditioning in the bus. I say turn it on 1/3 of the time. And the good things like hand washing, increase it 3-fold. So we have this 1/3, 3-fold thing. Do the bad things 1/3 at a time, the good things 3-fold. You're on your honor system. Everybody has to do it. Now the mayor says, help your neighbor do this. What, am I gonna help her wash her hands? No, I'm gonna wash my hands a lot. She's gonna see me, and I'm gonna say, do you need more soap? There's a shortage of soap. So we would try to encourage others by example to lean this way. This is kind of risky. The rest of the nation and world says, don't do this, don't do that. We're not really in that situation yet, and the right position is, can you do it less, and the bad things less, the good things more? We do not like abstinence. Really, Dr. Peng? Really? Show me. The NBA or the NCAA, they got these weird tournaments now, no audience. You know, really, if anybody had some guts, you tell them, you know those little, well, not those little, those games, can you have them 1/3 the time? Choose wisely, eliminate 2 and put on 1 for every 2. What one do I put on? I don't know, you guys decide. Maybe that's the championship games, maybe. But it would make their statement that that is the path to follow. I've looked at the medical models and all. That's how you diminish or slow down the invasion here. And I think I'll leave it at that. I'll be around for questions. Thank you.
Thank you, Dr. Peng. And now our airport manager for Maui County, Mr. Marvin Muniz.
Thank you. Thank you, Mr. Mayor, Council Chair, and our rest of our emergency responders. I'd like to thank the County of Maui and also the Department of Health, for their support. And Mayor mentioned earlier about the partnership and the teamwork. And I can honestly say it's been a great relationship, working with MEMA and Civil Defense, and also Dr. Pang here, who has came to the airport on numerous occasions and conducted workshops for our staff at the airport. So we're reaching out to the airport community, the tenants, and now we added in recently the car rental facility. So some of the steps we've been taking is we're ramping up our cleaning throughout the terminal. We've added a few more custodians to the shift. We're also actually looking at a midnight shift after our shift, so we can increase the disinfecting of the restrooms. Currently, we added 2 more runs throughout the day, so we're up to about 5 heavy cleanings throughout the day based on passenger volume. We're trying to hit the high touch point areas. We've installed 100 hand sanitizing stations, and we've had 50, so we doubled that up. We've got an accurate amount of soap to cover these stations. We've placed a lot of stickers. In fact, I'll show you the little sticker we made. We tried to add some character to it, so lend a hand by washing your hand, and put a little palm tree in there and a little, and so again, we're just trying to get the message out to the visitors and the employees and the locals alike that, do your part. We've put some information up on the flight information screens. We've also put some up on our advertising screen. So I think we got the message out there, and we just want to be sure everybody do their part. We reached out to the food concessions. A lot of the free food samples have stopped, the free cookies, the free candies. But we're able to stop that, at least for now. and we'll see what happens. We got airlines involved in cleaning their tenant spaces, their ticket counters, their baggage claim offices, and also some of their own personal back offices. So they're all on board. They've got their own cleaning supplies. We're helping that in that portion as well. We reached out to the car rentals to be sure that they too are doing their part. So they're also doing a form of disinfecting as the cars come in. So I think for the most part, you know, we're trying to reach out, get the message, and hopefully that'll work for us. And you know, again, our goal is to be sure that we get everybody to stay safe and get the word. Thank you.
Sure, you want to say something additional? Go ahead.
Sure.
I just wanted to make a point of clarification, me being the only female up here. Maybe FDR took the credit, but it was Eleanor Roosevelt that said, nothing to fear but fear itself. Happy Women's Month.
All right, thank you. And I hope that at this point, you and the public, as they read and see and review on Akaku and other channels, that the County of Maui has a great partnership with our state, our medical community, our agencies, emergency, our departments, all of our groups that are out there that are working together to ensure your well-being and your family's health and safety. You know, this is paramount right now, and I think we've all taken this very seriously and working very diligently to make it happen. I want you to know that as far as your mayor and the council, all of us here that stands before you and others that are out there, we are going to work tirelessly to prevent this spread of the COVID-19. Like Dr. Weiss said and Dr. Pang said, it'll probably come. I pray that we don't get 70%. I hope it's like the mumps. Out of the 1,000, we get 7. You know, I would pray that something like that is the end results of all of our hard labor. However, even if that is not the fact is we took the proactive approach. We've been working hard to make sure that our community stays safe. And when I talk about our community, our vulnerable population, our seniors, of course, is the biggest one. But we have a homeless population that exists out there, and we're doing what we can through some of our nonprofits and through some of our agencies to make sure that they've gotten what they need, you know? And so I am looking at a couple of requests from the state and as well as other agencies. Number one, we do not at this time have confirmed any quarantine station. We need quarantine stations just in case. I am asking the Department of Transportation, Airports Division, I haven't asked Marvin, but I asked the bosses, that we could look at the rent-a-car center, the old rent-a-car center, where all the rent-a-cars were before. And there's got buildings there, they've got it fenced, they've got plumbing. We could do a lot of quarantine and treatment right there, and accessible to the airport and other supplies, very accessible to medical staff and medical facilities, so we don't inundate our hospitals or clinics, because we need something if an outbreak is to occur. And so that is my first goal right now. I did ask for the Army. I was turned down on that part. The National Guard Army, I was turned down, but I'm still working on that. We are looking at other areas, even in West Maui and South Maui, that we could put something together so that citizenry would be also protected and kept safe. East Maui and as well as upcountry, we're all looking for spaces there also. So, but right now, the reason I'd like to keep as much as that in Central is because of all the medical staff and medical facilities that are here available to help us. We start spreading ourselves all over the place, it's going to make it very tough. You know, so I'd rather transport them in and keep them in a central area than having them all over and trying to spread the limited personnel we have in the medical field. Right now, if we stay concentrated, we're good. But if I got to send 10 to Lahaina and 12 to South Maui, I think Dr. Weiss and Dr. Pang will agree, we'll be stretching it thin and really wearing out our resources on personnel. As far as supplies are concerned, you've heard from the various emergency departments and our medical facilities. I think we're in good shape right now. But we are looking to order more. We are looking to keep our stock. But talking about stock and supplies, let me reiterate one more thing. Do not hoard, ladies and gentlemen. The public right now should understand that you need toilet tissue, you need water, you need masks, you need hand sanitizers, you need gloves. Great. But don't be buying 5 cases when you really only need 1 or 1 box or 2 bottles, you know. We are getting supplies in on a steady basis, but when people rush in, like you saw on those pictures in Costco, taking 4 or 5 cases of toilet tissue and other sanitizer and gloves and taking them, and 3 or 4 members of the family doing that, that's not good, because then A, you delete supplies, and B, you really hurt the public itself. Now you make other people panic. We have very little to fear right now. We've got a great team. We've got it under control. If we practice what has been told to us today by all these experts and a little more, I think we can come through this like other emergencies fairly unscathed. You know, again, we will have cases. I know it's going to come sooner or later, but I want all of you to know that we're going to do everything possible to minimize the impact of the COVID-19 virus. Also, I want to remind people, the flu season is here, and we are being hit hard with the flu. And so we worry so much about COVID-19, yet if I'm correct, and I think you said this today, Dr. Wise, and correct me if I'm wrong, like 30 million people are infected. Flu, and like over 30,000 have died from the flu. And COVID-19 has what, 200,000 or 1 million or whatever it might be. And I think what, 4,000 deaths or something like that? In the world. And we're talking United States, in the world. So we have a real propensity to focus on something we don't know, and that's okay too. But the known cause of what I call a lot of deaths and a lot of sickness is influenza. So if you haven't gotten your shot and you haven't done the right things, or you don't have different medicines that may help ease the flu, then you're putting yourself at risk and your family. So I'll close with that and open the floor up to questions from the. I'll start with you, young lady.
Hi, I'm Sahar with Maui Alert. Can you tell us how many test kits we have on Maui for COVID?
None. At this time, we're still waiting for them to come in. And we have test kits in Oahu, but they're not here on Maui. And so we're pushing very diligently, right, Dr. Pang, to get them, and Dr. Weiss.
This afternoon, I attended a meeting
Thank you.
specifically.
Dr. Weiss, why don't you come here?
Sorry, thank you very much.
Any
Mr.
question?
Mayor. This afternoon, I attended a meeting specifically to talk about testing. Dr. Barry Shitamoto, our pathologist expert, assured me that the test is now available in Oahu and in 2 private labs on the mainland. The turnaround time is about 72 hours, and it requires 2 flights a day to bring the tests, and then a turnaround time of about 48 hours to 72 hours. There is a big push to increase the number of tests that are available. Right now it's a manual test, and once the test is automated, they should be able to crank out a lot more tests than they can now. They can do about 200 tests a day right now at maximum output. To be able to get to the point of testing the right number of people, meaning people who are symptomatic and who are not symptomatic, will require quite a bit more testing. Let's be very frank. At the highest level where this started, we did not do a good job in the United States. We didn't do as good a job as other countries did. Let's get beyond that and quickly catch up. I believe within the next 4 to 6 weeks, not only will you see automated tests, you'll see those tests done locally as well. That's not ready yet, but it's coming. And I want to assure you about one thing. It's not fast enough for any of us. And we're complaining bitterly, and we're twisting arms every chance we can, and we're not going to let go until we get what we need.
Thank you, Dr. Weiss. Question, yes.
Okay, so since all these agencies here will probably have to work together if we had cases come here to Maui, can you guys walk me through step by step, how you'd work together, how you would respond to isolate the risk, disinfect the places guys walk me through step by step, you know, airports, DOH, hospital.
Well, I'll let you, Dr. Peng, kind of take that one, please.
So, yes, we actually had these kind of cases come in. And I'll give you a kind of general term because we're not supposed to disclose confidentiality, okay? But a guy comes in, he's on Maui 6 days, he gets sick. Then he goes to Oahu that day. So we look downstream who he could have infected, yeah? So we look at all his activities, where he was staying, what was the car he drove, and then the hotel. And we confidentially go and track his path to see who he exposed. That's downstream. Who infected him? Well, the guy was here 6 days, he came from Japan. Well, it's kind of wishful thinking that he got it from Japan, but we just finished saying and about to publish, 75% chance he got it on Maui. So you look for somebody sick who contacted him upstream, okay? And now it turns out that the nation shows us a lot of hidden upstream guys. So we simply track back case by case. That's case by case, okay? And then we go through this. If we find a guy or we find somebody sick, then we tell them quarantine yourself. I'm sorry, if they're not sick and exposed, they quarantine. If they're sick, then we isolate and we gotta find a place real quick to hold these people. And then finally, you watch this and you ask about this and it's fascinating and it helps initially. But when it really gets messy, like high rates and all, once again, I'm asking the public, everybody, to shift their behavior. Do good things 3 times more than normal, bad things 1/3. And the mayor is actually going to go around and say, hey, no unessential travel. So you say, yeah, I'm going here. And he's going to ask you, well, which 2 ones did you cancel or take by video conferencing? So that is probably the biggest effort. And then our effort, maybe it works, maybe it's not, but at least it will remind you all that if we're doing this and Dr. Weiss is doing that, then come on, do your part. And we will have like the mumps result, 7 when we're expecting 150. Okay.
Chivo.
Dr. Peng, what about masks? I've heard that they are effective, they're only effective for the infected. Could you clarify that?
Yeah, the mask, the simple mask keeps the stuff from coming out. So surgeons used to put the simpler mask so they don't cough or sneeze on the operating field. So you should put it on the person coughing or spitting. But if everybody just puts it on, whether or not they're sick, we're gonna run out of masks.
Yeah.
And then, it's like some people put their mask on when they're not sick. Well, for goodness sakes, if you're gonna do that, save your mask so that when you are sick, you have the mask. Well, how am I gonna save the mask? It's dirty. Maui, Hawaii, ambient temperature. Leave your mask out 24 hours and whatever COVID was on is gone. Don't wash it. You pack the breathing through material.
Other questions? Yes.
Did you say earlier about when you were talking about cruise ships, did you say that there was a moratorium on them, or are they
We
still
are
allowed to
asking
go?
for a moratorium. It hasn't been granted. It's a federal issue. I cannot stop them. I've been thinking about getting a surfboard and just standing out there when they come. You may look for a new mayor after that, but that's okay. I mean, one sacrifice is worth keeping these cruise ships out. But at this time, the federal government and through the leadership of Josh Green, we have asked them to at least put a moratorium for the next 60 days. Now, some of the major lines are shutting down. I forget, Sandy. What was the, Sandy? Excuse me. What was the cruise line that closed down for the next 30 days? Princess Cruise Lines has closed down for the next 30 days entirely worldwide, not just for Hawaii. And others are looking at that because they're finding major cancellations. And so I think they're looking at taking some time to clean up and disinfect their ships and take other preventative measures before they come back online. But right now, we have not, I repeat, have not gotten the moratorium from the federal government. Other questions? Yes.
Thanks, Mayor. Kate House on Maui News. So who and at what point do we decide to close down schools?
That would still come from the Department of Education, the state, and and they would be the ones that would mandate that closures of our schools. I believe that I would have a real challenge, and unless there's a real major outbreak with our children, because they are not as vulnerable as our senior community. In fact, the percentages is very low, if I'm correct, doctors, that children, even if they get infected or get sick, they're like a regular cold, they get well real fast. There's a lot of homeless and poverty-stricken families that attend our schools, and those are the only meals, breakfast and lunch, they get. And so I'd be really worried about closing our schools and giving them that impact of not having food available and then proper nutrition. So again, we'll see how this situation evolves. But at this time, it would fall back on the Department of Education and the state to shut down the schools if it was necessary. Yes, Colleen.
For Dr. Weiss, since we have limited testing capabilities right now, what is our policy for deciding, who to release and who not to? I've talked to some healthcare providers who said we suspect some people, but we had to let them go. We don't have the tests, here to do that. So what's the policy for that?
So first of all, there's a case definition. We've tried to expand that case definition away from just travel, fever, and cough, because we now know that the virus is far more endemic and is not always strictly related to travel. So two symptoms that are invariable for the majority of people who present are fever and cough. But as with any other disease, there are extremes on both ends, and I'm positive there will be cases that are not febrile and cases where there's no cough. For the patients that fit a case definition, the first thing we do is try to exclude influenza as the cause. The vast majority of them right now are turning out to be influenza. As testing occurs more frequently and is available on a more liberal basis, I'm positive we're going to find more asymptomatic positive tests. And you'll see a dramatic increase in, quote unquote, the number of cases that have been identified. But consequently, because the numerator and the denominator has changed, the incidence of fatality will fall. And that's an important thing, because right now we're not seeing a true representation of the true disease spread and process, because we're flying in the dark. How do we decide when to quarantine? Number one, if they fit a case definition and they have a high likelihood of either having come in contact with a known case or traveled to a region of high occurrence, we will quarantine that person, usually voluntarily. If they're sick and they require hospitalization, we'll put them in an isolation negative pressure room and hospitalize them. That hasn't happened here. It certainly happened in California. In terms of the gestalt, that's something that increasingly we, as emergency physicians, infectious disease doctors, internists, etc., have developed a gestalt based upon the number of patients we see, how they present, and whether their presentation is consistent with the disease or if it's out of proportion to disease. And for most of us, when disease symptomology is out of proportion to lab tests, those are the patients we begin worrying about, because it doesn't make sense. And we may just elect to send a test and quarantine until it comes back. It's also important that we also recognize that healthcare workers are not immune to this. And we have a limited number of healthcare workers. When 1 or 2 nurses go down, we've got a problem. 1 emergency clinician goes down, we've got a problem. In response to that, we've developed a fire brigade of clinicians who are willing to work more, volunteer, etc. Same with nursing staff. I'm very proud of this. But the short answer to your question is, it's more gestalt now, because we don't have rapid turnaround time of tests. We start by trying to exclude or prove influenza, and then we look at severity of disease and whether it's out of proportion to symptomatology. Does that make sense?
I'll look through my notes again, but yes. And also for, follow up to that, you're talking about some healthcare providers may also get sick as they're caring. What is the plan for, patients come in to, isolate the cases? Because I understand that there's negative pressure rooms in different departments. And so does that pose a risk to the rest of the hospital? How do you isolate maybe the ER or the ICU and make sure that
Good question.
those don't.
The first, as I started my conversation with you this afternoon, the first thing is to not let them in the building. Triage outside. Make sure that you take patients that are at great risk and don't let them into the building, where once that's occurred, we've just potentially exposed lots of people. So early in the course, our leadership recognized this, and nurses and doctors together developed a process by which we moved our triage outside the four walls of the hospital and didn't allow anybody to pass through there without either being masked or have personal protective equipment on, and then move them to an isolation area. In terms of the impact on the rest of the hospital, you can never have enough negative pressure rooms. We're using a combination of negative pressure rooms and portable HEPA filters. For the sickest of the sick and those that we consider the highest risk, those go into negative pressure rooms. We have about 9 rooms like that in the hospital. In terms of preventing spread through the hospital's own air circulation system, those are HEPA filters, those are ultraviolet light, and those are, again, preventing people who have the right symptomatology from even coming into the building without preventing them from spread before they get inside.
Are you gonna clear a ward and maybe isolate people in that one area?
That's a good question too. Again, it's dependent upon personnel. We will do that with, if we're presented with a situation where we have multiple patients requiring respiratory support with endotracheal intubation and respirator support, we will open a closed ICU and staff it and segregate those patients to that area.
Yeah, thank you. Again, I would like to thank everyone, Dr. Peng, Dr. Weiss, Marvin, and Moniz, of course, Herman and Daya, Assistant Chief Warner. Yeah, you have to turn because I know you need Mike, so I was going to say Mike, but I didn't want to embarrass Chief Ahuma and our Council Chair for being here, Council Chair Lee. Thank you very much for being here. I hope as you report this out and televise and broadcast or write about it, you will add these words into it. We are here to protect the health and well-being of our citizenry. We are going to work tirelessly to make sure that we protect them to the best of our capability. But they need to help themselves, help their neighbor and their families to also make this work. Mahalo and aloha to all.